Sounds very tin can.
Okay, I play another video.
Autonomous sections to facilitate administration at local and regional levels and to promote more effectively the aims and objectives of the college. There are currently 11 regions within Section 20 Asia sector that cover 16 countries. The number of countries under Section 20 Asia sector is expanding, and we've significantly grown in the number of new members over the past year. In Section 20 Asia, there are 7 categories of membership with different requirements for each of the categories. Emeritus Fellow, Master Fellow with outstanding contribution, Master Fellow, Honorary Fellow with outstanding contribution, Honorary Fellow, Fellow with outstanding contribution, Fellow for a member with at least 5 years clinical experience who has delivered significant contribution, Honorary Member, Member or Elite who has served the ICD with distinction, Member or Registered Dentists, Young Dentists with less than 5 years clinical experience, Elite, Non-Dental Profession Member, Student for undergraduate students. Fellowship in the college is extended by invitation only. A nominated dentist or member of the society must pass a rigorous peer review process leading to the recognition of the individual's outstanding professional achievement, meritorious service, and dedication to the continued progress of dentistry for the benefit of mankind. We believe a collective effort and ideas from both dentist and non-dentist professions will contribute to a more successful collaboration, making ICD a vibrant, agile, and dynamic organization.
Asia is actually one of the largest continents and with a very vast diversity in terms of cultural as well as ethnic group, as well as even in the language. So, and there's a huge disparity in terms of income as well as the oral hygiene. What is very important at the center of my heart is that we will need to be able to give to the less developed country for humanitarian projects such as community dental service, eradication of dental caries, control of periodontal disease, which is also known to be closely associated with the heart disease as well as strokes and other systemic disease. So there are a whole range of dental problems that ICD could actually work with. This is something that I'm going to share it with the rest of the dentists in Asia as well as in the world. I'm going to make many young dentists aspire to join ICD and to volunteer their service, which is essentially what ICD motto is, to serve and to recognize the service.
The International College of Dentists is the world's oldest and largest honor society for dentists. We honor dentists who have shown outstanding merit in their contributions to the profession and to the community. We do this by conferring ICD fellowship upon them. Together, ICD fellows around the world give back to their communities by providing humanitarian dental care programs. We give back to the dental profession through dental education initiatives. We support humanitarian dental care projects in over 55 countries. We promote dental education around the world so that the best dental oral health care is available to patients everywhere.
We're trying to grow the college, and we're looking to honor every deserving fellow worldwide, and thinking the top 2% in the areas of humanitarian service, in education, in leadership, in mentorship. The other thing that the college is doing, and the reason that we would like to have more members and a greater global presence than we even have now, is that we are trying to is a goal that we have. It's also a mission that we've taken on because we have a great wealth of talent in our manpower in our fellowship. We have a lot of the dental educators, the providers of humanitarian service, and we do very well in that regard between our fellows. And I think we have not just the opportunity, but the responsibility to provide humanitarian service worldwide.
So come and join the ICD, the International College of Dentists.
Join ICD.
Join ICD.
Join ICD.
Join us at ICD.
Join ICD.
Join the ICD. It's a great organization, and we prosper from your fellowship.
Okay, everyone. I think we will start soon. Now I will hand the meeting to TC.
Thank you, Prof. Let me just perhaps get the proceeding going in the early part before the meeting proper start. This evening we are having the International College of Dentists Section 15 webinar. This series has been going on, and today will be the 5th in the series. And this evening we are very happy to have the eminent speaker, Professor Bedros Yavru-Sakuk, and he's going to be supported by Dr. Valentina Getcha. But what it is that Dr. Getcha is going to make a representation in the panel. She's not actually speaking, but she's also a very eminent speaker in this field of myofunctional therapy that we are going to discuss this evening. Well, a little bit about our speaker tonight, Professor Bedros Yavru-Sakuk. He's obtained his French doctorate degree from New York University in 1975, and his American doctorate degree from the New York University in 1977. He's a professor since 1988 of the NYU College of Dentistry. He has an honorary doctorate degree from the State Medical Dental University of Armenia in 2015. Professor Sakuk is also a board member of the European Regional Organization, or ERO, and he's the chairman of ERO Enlargement Working Group from 2004 to 2013. He is a past vice chairman of the Dental Practice Committee of the very important World Dental Federation, or FDI, since 2012, from 2012 to 2018. With the Armenian Dental Association and also the State University of Armenia, he's the chairman of international relation of these two organizations in Armenia. Last but not least, he's the chairman of the board of trustees of the International Association of Myofunctional Therapy, or in brief, IAMTMD. That's Professor Bedros Yavru-Sakuk. Let me also make a few words of introduction to a very eminent person in the panel that's going to handle and help us with, and that is Dr. Valentina Getcha. She specializes in children's myofunctional treatment, CEO of the Moscow branch of the Myofunctional Research Company, Russia. She's the chairwoman of this organization for all Russian-speaking countries. President of the International Association of Organization and Specialists in Myofunctional Therapy in Medicine and Dentistry. And she has given numerous international lectures and events, particularly to her pet subject. So I like to greet Dr. Valentina Getcha and thank her for being in our panel. So at this juncture, I'd like all of us to put our attention and thank and welcome Dr. Professor Bedros Yavru-Sakuk. Can I invite you to share your screen and begin your lecture? Thank you.
Thank you, Professor Puha, for this great introduction. Do you hear me? Do you have the slide on the screen?
Yes, we have. Thank you.
Perfect. Perfect. So first, I would like to thank the president of the Chapter 15 of the ICD, International College of Dentists, dear Professor Hakim Schwan, for inviting me to give this lecture. By the way, Professor Hakim Schwan is a very dedicated, well-known, and very respected by all our colleagues in the World Dental Federation, FDI. Also, I would like to thank the International College of Dentists, especially Professor Mohamed Ibrahim, Chairman of the Continuing Education of ICD, to organize such a useful webinar series to help to improve the knowledge and the skills of the health professionals. Thanks also to Professor Puha, President of the Singapore General Practitioners Association, for moderating this session. Today, it is also our privilege and honor to have the participation of the President of the International Association of Myofunctional Therapy in Medicine and Dentistry, Dr. Valentina Gesha, to my lecture. Also, a big welcome to you all who are participating to this webinar. Just a few words about myself. Dentistry has been a wonderful journey for me in my life. I was fortunate to be educated internationally in France and United States, where I have been practicing in my private clinic. I also had been teaching at NYU, New York University, in departments of periodontics and implantology, as well as in the Department of Restorative Dentistry and Prosthodontics, due to the fact that I have 2 postgraduate degrees. Also, I have been elected by the General Assembly of the World Dental Federation to the Dental Practice Committee and served as the Vice Chairman of the Dental Practice Committee, for which I was awarded the Certificate of Appreciation of the FDI. Before beginning my lecture, I would like to say just a few words about the International Association of Myofunctional Therapy in Medicine and Dentistry, as I am the chairman of the board of trustees of the association. The association is a non-profit association which advocates oral health as part of general health, brings under the same roof the professions of medicine and dentistry, and it is formed by healthcare professionals who are dedicated not only to the oral health, but also general health of people and quality of life. The association is active in many countries, in Armenia, Australia, Belarus, France, Kazakhstan, Spain, Russia, Ukraine, United Kingdom, and United States of America. And also, the number of the countries where we are active, it's increasing, and this list will increase accordingly. The purpose of the association is in education, to provide continuing educational courses, in prevention, to provide much needed myofunctional preventive care to children and adults. And the ultimate goal of the association is to promote optimum oral and general health and to improve people's quality of life. So the purpose of my today's lecture is to emphasize the importance of myofunctional therapy in medicine and dentistry. This is a subject that one can talk about for hours, for days, and forever because of multi-purpose importance and efficiency of application in many specialties of medicine and dentistry. For most of us as dentists, usually we concentrate on the treatment of the teeth or extracting or replacing them, or moving the teeth with orthodontic treatment. And by doing that, very often we disregard, we overlook, or we don't pay attention to the neuromuscular dysfunctions of the patient. As you know, normal muscle function is essential for the normal development of the children's facial bones, the normal positioning of the teeth, and more importantly, for the normal development of the vital functions such as breathing, chewing, swallowing, and speech. The myofunctional treatment with specific appliances and specific muscle exercises has the important purpose of reconditioning and normalizing these muscle dysfunctions. Today, I would like to have an overview of the close relations and applications of myofunctional therapy in different specialties of medicine and dentistry. As I mentioned, the usefulness of myofunctional therapy are multiple. Some of the important applications of myofunctional therapy, among many others, that I would like to review today are for, first, orthodontics, the correction of malposition and malocclusion of the teeth, then abnormal breathing in relation with the ENT, ear, nose, throat specialty of medicine, the SRBDs, sleep-related breathing disorders in relation with the ENT and sleep medicine, in hearing in relation with the ENT, in body balance and posture in relation with the ENT specialty of medicine, the TMJ dysfunctions in relation of dentistry, in facial aesthetics in relation with facial aesthetic surgery and medicine. And personally, I think the most important of its application is in brain development, in behavior and psychology of children and adults. First, of course, orthodontics. In orthodontics, the purpose of myofunctional therapy is not to replace the orthodontic treatment. Of course, it is important to diagnose the muscular dysfunctions and bad habits of the patient at the first visit. Sometimes myofunctional therapy can be done at the same time with other orthodontic treatments, such as brackets or with teeth aligners. And with myofunctional therapy, it's also possible to normalize the growth pattern of the cranial bones. And sometimes it is even possible to correct teeth malpositions by only myofunctional therapy. In this video, you can see clearly that with only myofunctional therapy and correcting the posture and the function of the tongue, it was possible to put the teeth in normal position. The advantages of the myofunctional therapy in orthodontics: first, it is not a painful procedure and does not require any injections or tooth drilling or extractions or surgeries. Myofunctional therapy does not damage the enamel, no need for bonding to the enamel or dentin. There is no iatrogenic root or bone resorption due to excessive orthodontic pressures. Most of the times, there is no need for fixed retention of the teeth after orthodontic treatment. And the result of the myofunctional therapy is for a lifetime. The next application of myofunctional therapy is in breathing and airway, which relates to the ENT specialty of the medicine. As you know, normal breathing should be through the nose only and not through the mouth. The abdominal breathing is the right way to breathe. Thoracic breathing is not an efficient breathing. In abnormal breathing, less oxygen is provided to the body cells, especially to the brain of the child. If the abnormal mouth breathing is not treated as early as possible in childhood, it can complicate into an SRBD, sleep-related breathing disorder, such as irregular breathing, snoring, or worse, an obstructive sleep apnea. The OSA in turn can be the cause of insomnia, drowsiness, cardiovascular problems, as well as serious psychiatric problems. Myofunctional therapy is a very important preventive care for SIBDs and especially for obstructive sleep apnea. Here, you can see the child's obstructive sleep apnea. The child is 3-year-old. As you can see, the child is gasping for air and has difficulties of breathing. I'm going a little faster to be able to have time more for questions and answers. As you see, the poor child is fighting, literally fighting, to get some air into the lungs during the sleep. And the sleeping, instead of being relaxing and resting experience, it becomes a torture and a source of additional stress for the child in general. Unfortunately, it is very disturbing to see such videos of a sleeping child and being tortured. The issue of SRBD is so important that I wrote an FDI policy statement about the SRBDs and dentistry, which has been approved by the General Assembly of the World Dental Federation during the FDI World Dental Congress in Buenos Aires, Argentina in 2018. This policy statement aims to highlight the important role of dentists in prevention, early screening, and treatment of young and or adult patients with SRBDs by establishing effective interprofessional collaboration with medical sleep doctors. Here on this diagram, as you can see, the partial or total blockage of the nasopharyngeal area, the retropharyngeal area, by the posterior section of the tongue. Either partial obstruction, which causes snoring during the sleep, or complete obstruction, which completely closes the airway and which causes the obstructive sleep apnea. As you know, there is a classification for the throat obstruction with the Malampati score from class 1 to class 4, based on the degree of visibility of the hard palate, soft palate, uvula, and the pillars, beginning from normal view of the throat, which is the class 1, and gradually, the throat is obliterated by the tongue, and class 4 is a complete obliteration. Here, on these pictures on the left side, you can see the difference between the normal throat, but you can see the uvula and the throat and the retropharyngeal area. And the right side, it's the throat of a snorer with much bigger uvula, and the throat is partially obliterated. As treatment for SRBDs, of course, there are the CPAP machines. CPAP meaning continuous positive airway pressure for children and adults patients. However, these CPAP machines have serious problems. First, they are not comfortable and they disrupt the sleep of the patient. And in addition, a study made by Soleil Demarche Roberts at the University of Michigan shows that the pressure to the midface of the child may interfere with the normal facial growth, resulting in maxillary retrusion, counterclockwise tipping of the palatal plane, and flaring of the maxillary incisors. So it's quite dangerous to use them on an infant sometimes or a child. Instead of CPAP machines and their complications, today the treatment of SRBDs with removable myofunctional appliances combined with myofunctional exercises are considered as the most convenient and comfortable way to treat the slight, mild, or even sometimes severe SRBD problems. In addition, removable mandibular advancement devices can be used to open the bite, push the mandible forward, which in turn opens the airway and normalizes breathing of the patient. Here we have many types of mandibular advancement devices. The look is different, however, the principle or the way of the action are the same: to open the bite, move the mandible forward, and to open the airway for easier breathing. And the results are remarkable, as seen on the CBCT. First, on the left side, the airway is compromised and limited. And on the right side, after myofunctional treatment with removable appliance, we can see that the airway is much more open and the patient breathes much easier. In addition, there are ready-made myofunctional appliances to treat snoring, such as S1 and S2 of MyoBrace company, which can eliminate snoring efficiently. Of course, in case of snoring and obstructive apnea, it is necessary to have a consultation with a sleep specialist for a professional sleep evaluation, either in a specialized clinic or to have home evaluation with a kit provided by the sleep specialist. However, it is possible to check the quality of your sleep by yourself and to see if you are snoring or suffering from obstructive sleep apnea. There are simple applications that you can download from Apple Store, such as Sleep Cycle, and you can check your sleep quality very easily by yourself. As you can see, I did it for myself. I used the Sleep Cycle applications, and on the diagram on the left side, you can see that the time in the bed is 6 hours, 19 minutes, and I have been snoring 1 hour, 13 minutes without appliance. And the next night, I used the S1 appliance, and you see that snoring is 0 minutes. It has been completely and efficiently eliminated. The next is myofunctional therapy, also efficient in correcting and improving the hearing and body and balance of the posture and the balance. This aspect of myofunctional therapy is in relation with the ENT specialty of the medicine. Here we can see the diagram of the ear, the external ear, middle ear, and internal ear. And the internal ear is in communication with the retropharyngeal area with the eustachian tube. The middle ear is very important section of the ear because It is both the center of balance of the body due to semicircular canals, as you can see, and the center of the hearing due to the cochlea, from where the sounds received from the external ear are transmitted to the brain through the auditory nerve. All infections of the middle ear through the Eustachian canal due to the blockage of the nasopharyngeal area or the infection of the nasopharyngeal area by the posterior position of the tongue can disturb body balance and hearing. By placing the mandible and the tongue in a forward position, it is possible to clear the opening of the internal ear in the nasopharyngeal area, decreasing or eliminating the possibility of the middle ear infection. Therefore, myofunctional therapy can improve hearing, can also decrease and eliminate tinnitus, noise in the ear. In addition, myofunctional therapy can also eliminate dizziness and improves body balance and body posture. Just a remark at this point about the body position of the baby during breastfeeding. The body of baby should be vertical when the mother is breastfeeding, instead of horizontal, to prevent the middle ear infection from the milk going into the middle ear through the Eustachian tube of the baby. Now, I would like to show a video for myofunctional therapy and TMJ dysfunction, which clearly explains the consequences of the mouth breathing at the level of oral cavity and the TMJ.
Airway and TMJ. The normal way to breathe is through your nose. As we grow and develop, certain things such as pollen, cow milk, and other variables can cause an allergic reaction, causing the lymphoid tissues known as tonsils and adenoids to become swollen. As the tonsils and adenoids become swollen, they develop into an obstruction for nasal breathing, and slowly mouth breathing begins to be the primary intake of air into the body. In order to breathe through the mouth, the lower jaw comes down, the tongue comes off the palate and settles on the lower teeth. Nasal breathing is the correct way for air to enter the body, and during nasal breathing, the tongue rests at the palate and the pressure of the cheeks is balanced by the tongue. During mouth breathing, the pressure from the cheeks is unopposed by the tongue. The oral system becomes unbalanced and results in the deformation of the upper jaw, creating a V-shaped arch as opposed to a correct U-shaped arch. This also produces an incorrect swallowing function. Upon swallowing, the tongue rests on the lateral teeth, hindering normal tooth eruption, causing a lateral tongue thrust. A constantly open mouth causes the incisors to over-erupt. The result is a deformation of the lower arch known as the bicuspid drop-off. The result of this deformation of the upper and lower arches is the presence of premature contacts upon closing, which shift the lower jaw distally off of the physiologic trajectory. The narrowing of the upper arch pushes the lower jaw back. This forces the TMJ condyle to shift distally while the TMJ disc shifts forward. Upon opening, the disc can shift onto the condyle to restore the TMJ's correct position, reduction of the disc, and then shift back to an incorrect forward position upon closing. This is what causes a reciprocal click. In addition, the muscles could be in a state of hypertonus or spasm, which can result in tension headaches. An incorrect position of the lower jaw can result in impaired functional activity of the muscles, such as clenching and grinding. Over time, grinding can result in severely worn down teeth. As a result, the teeth become even shorter, the lower jaw shifts distally even further, and the vertical of the bite decreases. In time, joint degeneration occurs. The joint becomes deformed, and the ligaments of the joint become damaged. As a result, the TMJ disc can get trapped in front of the condyle. While the click may go away, limited mouth opening will occur. A distally shifted jaw and tongue positions result in even further restriction of the airway. In order to open up the airway, the neck moves forward and the head tilts backward. This stresses the spine and fatigues the neck muscles, which results in neck, back, and shoulder pain.
As you can see on that video animation, the importance of mouth breathing, the consequences are really very detrimental. Here we can see the CBCT of TMJ, and the before and after myofunctional treatment. Before, let's say, you can see the head of the condyle, it has been eroded due to muscular malfunctions. And after treatment, myofunctional treatment, you can see after 2.5 years, the head of the condyle, the anatomical shape, it has been reshaped. The condyle gained its normal shape, and all symptoms, including pain, clicking, and limited opening of the mouth, are eliminated, and the patient is very healthy and satisfied. Myofunctional therapy has also an important role in facial aesthetics. By normalizing muscle activity in the orofacial region, it can also improve the facial appearance and aesthetics of the patient. The horizontal forward growth of the maxillary bone beginning in childhood is very important for the facial aesthetics of the person. The craniofacial bony structures and components can be modified, shaped, and reshaped at any age by myofunctional therapy. Therefore, a myofunctional therapist we can call also a non-surgical facial aesthetician. On this picture, we can see clearly before and after the result of the myofunctional therapy, the maxillary growth after treatment and the mandible coming forward, giving a natural and beautiful, aesthetics to the face. Again, on this case, you can see a retrognathia of the mandible and the maxillary, after treatment, you see the maxilla well developed horizontally and the mandible following to the normal and aesthetical position. Of course, facial aesthetics is important for the self-esteem and confidence of a child. However, the brain capacity of a child is even more important. As we all know, the brain cells are very sensitive to oxygen. A person is pronounced dead if the brain does not get the oxygen for more than 3 minutes. If breathing is abnormal and difficult through the mouth for the child, the brain cells of the child will not get proper oxygen amount to develop properly. If the brain does not develop properly, it will not function at full capacity. And the result is that the child will not be able to focus on a subject. And this can be the cause of a learning deficiency and also the reason for the success or failure in school. As we say, a picture is worth thousands of words. Here, from the facial expression of the child, we can see what a proper myofunctional therapy can do for the attention, the concentration, and alertness of the child. By the way, this is one of the many cases treated by Dr. Anna Menlikova from Samara, Russia. The brain oxygenation, the development of brain capacity, and the full development of the brain functions of a child are of a vital importance that parents should be aware of and take the necessary steps to have their child treated to prevent and eliminate the disastrous consequences of the mouth breathing. Unfortunately, many parents are not aware of these facts. The lack of concentration and the learning deficiency can be the cause of psychological problems such as complex of inferiority and depression, and even sometimes the cause of hyperactivity and violent behavior. With proper myofunctional treatment, by normalizing breathing and the other vital orofacial functions of the child, will favor the normal oxygenation and the normal maturation of the child's brain cells, which in turn will improve attention, concentration, learning, and memorization. Therefore, better results in school and later a more successful life. As conclusions, first, of course, all muscular dysfunctions should be diagnosed and they should be noted on the patient chart at the first visit as much as possible. If needed, the treatment should begin as soon as possible, or the patient should be referred to the myofunctional specialist for proper treatment. In most of the cases, collaborative approach for treatment is necessary with the participation of the proper specialists, the medicine, dentistry, and in myofunctional therapy for a more efficient, complete, and comprehensive treatment of the patient. As you can see, myofunctional therapy has an utmost importance in the general health and well-being and quality of life of the people. However, as I mentioned, unfortunately, myofunctional treatment has been often underestimated and ignored. Today, myofunctional therapy should be recognized as a distinct healthcare specialty because of its application in distinct therapeutic ways and its importance in the medicine and dentistry. And also, myofunctional therapy should be part of didactic and practical educational curriculums of the medico-dental universities and taught as a, if possible, as a specialization. Also, the governmental health entities, such as health ministries, should recognize the specialization in myofunctional therapy. For additional information about the International Association of Myofunctional Therapy in Medicine and Dentistry, and to become a member, to be able to take advantage of the continuing education courses, to improve knowledge and treatment techniques with latest developments, and to be in touch with the leaders of the myofunctional therapy worldwide, I would like to give, on this slide, you can get in touch with Dr. Valentina Gesha, who is the president of the association, and the email is info@myofuntherapy.com, or you can call, the phone number is there, or you can even, get in touch and get all necessary information. Because, as I said, myofunctional therapy is a very important subject. And today, it was only an overview of different applications. And each application of the myofunctional therapy can be the subject of a separate lecture in detail. But the importance of myofunctional therapy is there, and the importance of the association is there to be able to, let know to the people, to the parents, of course, the practitioner, the health providers, the importance of correcting all these neuromuscular dysfunctions in time. Many times in my many years of practice and teaching, I have seen children and parents not caring about the mouth breathing, which, as we see, has very important, impact to the health of the children and for the future, the quality of life of the adult. So, finally, I would like to thank you all for your attention, for your participation to this webinar. And Valentina Gesha and myself will be glad to answer all the questions that you have. Thank you again.
Thank you, Professor Bedros Sakko. I'd like to invite that if anybody has any questions, there's a chat box. Kindly type your questions on it. We appreciate it if you also indicate your name and where you come from. And also for Professor Bedros, yeah, sorry, my what about, there is a question I can see here about the role of adjunct therapy like soft laser, acupuncture, and microwave therapy in regards to myofascial therapy. This was a input by Professor Ashad Malik from Pakistan. What is your opinion on it?
First, thanks for the question, Dr. Malik. Of course, it's a positive addendum to the myofunctional therapy. Every little bit of the knowledge and application of ways of laser acupuncture is a plus. Makes treatments easier, faster, and to the point. And I welcome all collaborative efforts of professionals, health professionals, for the purpose of having a successful result. As you know, it's a collaborative approach. The myofunctional therapist by himself or herself is not able to have a positive result. Of course, it should be, as I mentioned, a collaborative effort between the medical, the dental, and the myofunctional therapy, and including laser and other acupuncture treatments and so forth. It will be welcome and it will be beneficial to the patient.
Thank you. Maybe a question here for Dr. Gesha. In your line of treatment, and I can see you're very much a pediatric type of approach. How young do you intervene, or how do you look out for some of these myofunctional problems in infants, for example? Professor Bedros did show a very interesting script of a 3-year-old child having a sleep problem or breathing. What is your opinion or your input to this discussion?
Okay, thank you, Dr. Pua. And first, I want to say thank you for inviting me as a panelist to Dr. Kim Chuan. And it was a pleasure for me to participate in a lecture of Professor Dr. Bedros Akuf for this really important subject of myofunctional therapy and needs of professional medicine and dentistry. And what we can see in our practice is that by our parents, it could be evaluated in few months when small kids, just newborn, start breathing to the mouth, not through the nose, for example. And this is a minute, then we have to start following this kid. Definitely, it isn't impossible to diagnose in polyclinic or general practice, dental practice, so young. But at 2 years old or 3 years old, as soon as the patient, this kid, appear in your practice, you have to check few points and make a few questions to our parents that they have to follow the kid during nighttime and during daytime, because it starts muscle menace with behavior, how they eat, how they speak, how they breathe, how they play, and really important, how their posture during relaxing, for example, watching movie or something like this when they are not under self-control. So we can evaluate it 3, 6 months, years old, or when they start breastfeeding, for example. Time to time is depend not just because of mom's anatomy, but also some abnormal functional of the tongue just after the birth. So it's really important to collaborate with therapists and, for example, chiropractors who follow kids just after birth. Because as we know, in Europe medicine, the way of birth is not really comfortable and normal for a kid. So my answer will be as soon as possible, as early as possible, but at least at 3 or 2 years old, our infants should be evaluated by dentists who know these things or other medical professionals who know what they look for. That's why we continue working with our association and try to make integrative approach with medical and dental participants and doctors to show our parents how it is important to prevent all these risk factors for our kids. Thank you.
Thank you. Thank you. As I can see from the chat box, and I think I would invite both Professor Bedros and Dr. Gesha to look into the chat box. There is a question from a participant from Indonesia, Dr. Danisa. And the question goes like, what are the differences or the advantages on the different types of appliances that that are being used? I think the appliances are referring to the lip bumper in particular. Do you have any comments on that?
Yes, if you want, I can start answer this question. And definitely, it's really important to train oral muscles and especially lip muscles, because in relaxed position, our mouth should be closed, so lips should be complicated to keep it closed, not by other muscles, facial muscles. So appliances that have lip bumper usually used by therapists, but also it should be done properly, because about anatomy, you know, the muscles antagonist, it should be worked properly, and we have to educate our parents and our kids how to do exercise with or without any appliances. It's just like a sport. When you start sporting, do sport, you have to train regularly, and it will have a good results for the future.
The lips are muscles, and the lips, they should be trained so that they become enough powerful to participate to the pressure on the teeth and to bring the teeth in normal position on the arch. So it's a positive approach, you know, and it's a good thing to increase, you know, with exercises, lip exercises, the power of these muscles that are very useful for myofunctional therapy.
Good. I see the organization that you have, the IAMTMD. Perhaps could you share with us as dentists, what are some of the outreaches that we can do with our medical colleagues in terms of getting mutual understanding? Because sometimes we don't know what each profession or each discipline can do. Can you share some successful example that you could have done, such that myofunctional therapy is accepted at a national healthcare level? In this case, I'm pointing to a question, if anything, or just a comment made by a fellow from Singapore, Dr. Yu Wing Chu, who is very much into myofunctional therapy. Could you give us some advice as to how one can reach out to the other medical discipline to get acceptance?
For each cases, you know, it's important to collaborate. Successful treatment, you know, in any case, any specific case, and the case can be different, which the breathing difficulties, swallowing difficulties, you know, the abnormal, you know, growing of the cranium bones, facial expression, the facial aesthetics, you know, the relation with the ENT is very important. The relation with, you know, other specialties, as I mentioned, you know, it's important given the case of the patient and the need of the patient. It's after diagnosis has been placed, you know, to get in touch with proper specialization in medicine so that we can establish combined treatment plan to be able to be applied to the specific case. So all depends from the patient's neuromuscular dysfunction and the needs, so that we can, as dentists, diagnose, for instance, SRBDs, sleep-related breathing disorders. I have seen so many cases and personally treated some of them, but it's in all ways is in relation with the sleep specialist, sleep medicine, so that proper evaluation is made at the special clinic, sleep clinic, or at home, to be able to have, a treatment plan applicable to the specific case, to specific needs of the patient.
Thank you.
I would like to.
Excuse me, yes, Dr. Gesher.
Yeah. Sorry, I would like to add about this question. If I understood the question correctly, it was about administrative part of organization in assistance of this kind of myofunctional therapy in medical or dental practice. Am I correct? The question was about this?
Yes.
Yeah,
yes.
And if the question about this is exactly our goal to make a new format of collaboration between Ministry of Health, Ministry of Education, and Practice Committee in Medicine and Dentistry to help our participants to use officially in their clinics. But however, now it is still possible to use international classification of diseases to use some positions absolutely officially in your practice to follow main points of myofunctional therapy. It will include full diagnostic, it will include rehabilitation, and full exercise program for kids. So it depends on practice that you have. Is it dental or is it general health? But in details, all you can find in international classification diseases, 10 and 11, all included. And if you would like, I'll be happy to share this information with colleagues.
Well, I note with interest, Dr. Gesher, you're very much influential or experienced with Russian-speaking type of situation. And Dr. Bedros, you spent a good time of your career in the North American scene. Perhaps in your respective experience, how has myofunctional therapy been accepted, or what are the challenges that you see in between exactly what we're discussing here, between difficulty of acceptance, both in terms of education? In many ways, we have to understand that we as dentists don't even understand the power that we actually have on the outcome of the growth of these children and people. How are your experience, and which is where some of us are interested how we can cooperate with our medical, or for that matter, educate our medical colleagues that such things, cooperations are possible. Perhaps you can share us some advice or experiences how we can reach out to get a better outcome.
The magical word that you pronounce, Professor Puha, is education. Educate first ourselves. Educate, because a lot of dentists today, of course, I understand that they have financial obligations and so forth after school, big expenses, and to buy practices, big expense and everything. They want quick money. I understand, to place implants, to do extractions, bridges, and everything to make quick money. Myofunctional therapy, it's a question of patience, commitment, and time. So this is very important to tell to a young practitioner who opens, after all these expenses, office, dental office. They want to make money. I understand. But here the problem is the health of the patient, the need of the patient. This is very important. So educate our professionals, colleagues, about the importance of the myofunctional therapy. Educate the parents, which is very important too, because the parents are part of the treatment. We can tell to the child, but the child cannot do by himself or herself all these exercises. There is a session in the clinic, and after that, the more important session is at home. that the parents should follow step by step to be able to have a successful outcome. So education of the parents is important also, so that, combined with professionals and the parents, we can have, the treatment of the children efficiently. The parents, they should know that it's dangerous. They are dangerous. And this is not only danger of the teeth, malposition. It's not only the problem of aesthetics. These are problems, much more serious problems with, disturbance of the sleep, where the body should rest, the mind should rest in children and even adults, and the next day to continue their responsibility in their job when the body and mind is not rested. It's a torture. This is very important. The people, they should understand, that it's a very important point. And also, as I mentioned, psychologically, it can destroy completely the child. It can completely destroy, the adult, the lack of oxygenation due to abnormal breathing, difficulty of breathing, which has importance, effect on the body posture and the head coming down. So this shows how powerful are the consequences of the mouth. The early age and the development of the brain is very important for the success of the child. So I think it's education, educate, and to try to make them understand the importance of such treatment.
Thank you. Dr. Gesha, do you have any inputs further to that?
Yeah, and just after, I absolutely agree with Dr. Professor Bedros Yavrusakoub. And after you will finish with education, your practitioners, your doctors, you also have to speak with owners of the clinic. I don't know how in your regions, but here in Russian-speaking area, most of the time, owner is not the head of the clinic. So we can be absolutely agree with the head doctor, main doctor in the clinic, but we have to speak with owner, with the company who finance all this process. And in this case, it's really easy to explain to them that the myofunctional treatment, early treatment, is a really good way of doing money, but at the same time, we will keep our patients healthy. Why? Because we continue working with families, not just with one kid or one adult. We will start following with full family to work in big part of prevention. And I really hope that soon we will find great support from insurance company that will do preventive programs for kids, not just in case of horrible diseases, but also in general.
Right, thank you. Thank you for both of you for your inputs. There's one, excuse me, there's one technical question here that I see is from a doctor from Malaysia, Dr. Ratnasuti. And the question goes like, will the twin block help in sleep apnea in a class 2 malocclusion? Twin block helping in sleep apnea in class 2 malocclusion.
It's possible. It's possible to use twin block 2. It's useful, and I think in some cases is even recommended to use the twin block 2. And it's I don't see any arguments against that. And the question is a well taken question, and I agree that it's possible to use it.
In the lecture that you gave just now, Professor Bedros Sakoub, you did have a slide where there were several design of appliances. In your treatment, what is your preference, or what is your key objective in that these appliances are hoping to achieve?
So these are different let's say, design this different. But the principles, as I mentioned, are the same. To open the bite, to move the mandible forward so that the airway is opened. It's all a question of first and foremost, the doctors being at ease to recommend, this appliance to the patient, and also the ease of the patient for the use of these appliances. Some of them, they have a bigger, preparation, and some others, they are more acceptable for the patient. So in fact, all depends from, the acceptance from the patient, but all are based on the same principle of way of action. And personally, I don't have any preference. The preference comes from the patient. If I see that the patient is not, let's say, satisfied, and the appliance bothers the patient, then I change. It's the fact of the patient being satisfied is of utmost importance. If they are satisfied, fine. If not, we are flexible. We are not here to force something in the mouth of the patient.
Thank you. Dr. Gesha, there is a particular question here. Maybe you can input that because it's also related to technical appliance, and that's from a Professor Laura Himawan from Indonesia, and she has a related one on myofunctional appliance relating to use for kids to correct their mouth breathing. What is your input on that one?
Thank you. First, I would like to add a few words about twin block or any other removable orthopedic or orthodontic appliances. We have to understand that myofunctional therapy, yes, it can include any appliances to help our patients and our practitioners to work with. But we have to remember that this is retrained muscle. So if we will just put any of appliance into the mouth and just leave it like this and will not educate patient to do something other way with his or her muscles, we will never have other result that we already have. So if we will follow the same pattern, muscle pattern, as 3, 4, 9, or 20 years during their life, nothing will be changed. This appliance or other appliance, when you will remove it, you will have collapse again. And that's why it's really important to have appliance plus exercise. You have to train your muscle every day, like I said before. Like you go to swimming pool or you go to gym, if you will just have your squat tool and put it under the bed, it doesn't work for your muscle. You have to train it. So you have to remember that as soon as you will remove any appliance from your mouth or from the mouth of your patient, the tongue should stay up on the roof of the mouth. And if you will not educate our patient to do this, all result of your work during half a year or 9 months, in couple months or 3 months or 1 year will relapse. So this is about removable orthodontics or orthopedic appliance. All of these work the muscle memories the same way, and they follow the skeletal problem or bone problem. And myofunctional therapy or myofunctional correction will work with muscles. This is a big difference. It's not the one or other treatment. It should be together. And what about the second part of the questions, myofunctional appliance for infants and for kids for mouth breathing? Yes, there are a lot of different techniques and different appliances that you can use, but the main idea that you have to find the way how to train kid, close his mouth, start breathing through the nose, and keep his tongue up on the roof of the mouth. If you have a possibility in your region, in your country, in your city, in your clinic, for this family, fine, great, you can use any appliance that you have in your practice. But for example, in Russian-speaking regions, not each family can have this kind of treatment because it with appliances. And in this way, we can work without. But definitely, it will be much more complicated for parents, and it will take more time from their side. Time or finances usually make difference. So you have to remember that this is about muscles, and we have a different tools to help our patients to be successful in treatment and to motivate them to stay on this treatment, because nobody likes to do something 2 years each day the same way, because they're kids. It's normal.
Definitely, I agree with Valentina Geisha about the muscular exercises, that it's very important. The normalization of the action of the muscles, it depends from the patients doing the exercises to strengthen the muscles and to keep in position the tongue and the other muscles of the face. But also, it's not possible to do one case with only one appliance. Based on the situation and the need in the treatment plan, it's possible to use 2 or 3 appliances that it's exactly necessary at that point of the treatment. So it's not possible to say that the twin block will do. It can be twin block plus another appliance, based on, the progression of the treatment. And this way, with the necessary adequate appliances, it's possible to have the good result. Thank you.
Thank you. Well, my comment over here as a moderator is that in this audience of ours as the International College of Dentists, there are mostly fellows here, and there are other guests who are here, dental colleagues. It really is quite a wide spectrum of dentists with different experiences in so far as myofunctional therapy. Well, that's why it's very good to come in and have a publicity kind of thing where we educate, because like you rightly say, the education is key over here, because ultimately we have a common objective, although sometimes in our way of getting to the state objective may have slightly differing opinions. So I can sense that it can be a topic that takes a lot of discussion and different therapy as well. So it's very, very useful that we have both of you here to help us discuss on this topic. And for dentists who are new in this, it is certainly eye-opening to see another facet of myofunctional therapy coming in to treat some of the things that we oftentimes see in our practice, but probably we miss out as to what is the etiology of some of these things that we see in practice. But ultimately, at the end of the day, for the sake of the profession, we'd like to seek for education and understanding between different disciplines. I would like at this juncture to invite any further questions on the topic today on myofunctional therapy from anyone in the audience. You may want to type it on the chat box.
While waiting, I would like to make a comment about the difference of opinions about applications, about appliances, about the way of treatment, about plan of treatment. You see, the difference of opinions is really good because it's the base of discussions, it's the base of decisions to improve the delivery of and improvement of the myofunctional therapy. So it's not possible to have everybody having the same opinion. So the different opinions, they are very respectable. I love it. I love to discuss and to try to have, let's say, a conclusion and to improve the delivery of the myofunctional therapy. So all are welcome.
Excellent. Excellent, which is what the International College of Dentists really stand for. We are here for better international understanding, and Section 15 It's very much a very special section in that our width and breadth of reach of countries in Asia is quite tremendous. I see my friend Professor Arshad Malik here, and we have across the other side, across to Singapore, Malaysia, we have a very wide reach of group of countries, and we are very happy that we can come together in this instance. And in fact, I like at this juncture, I don't know if our president of our section 15 like to be acknowledged, but today is actually his birthday. So on behalf of the organizing committee and education subcommittee, I'd like to wish very happy birthday to Professor Dr. Hao Kim Chuan. May he have many good years of good health and success, and continue to lead section 15 to greater heights. So thank you again. I'd like to invite in the chairman of the committee, Professor Muhammad Ibrahim, to come on board to make some closing statements and maybe some administrative instruction on further webinars that we have in mind. Professor Ibrahim?
Thank you, TC, for moderating the session. Okay, and thank you, Prof. Bedros and Dr. Valentina, for sharing the session today with our members. And we hope that with the information that you share will be useful to our practitioner in the region, to have stayed with us for the last about an hour or so. And as Dr. TC has said just now, this is our weekly webinar sessions. And again, for next week, we will be inviting a speaker from Pakistan, Professor Nauman Khan. She's going to talk about managing COVID patient pandemic during this COVID pandemic session. And of course, this session will be moderated by Professor Arshad Malik, the region of Pakistan. And we hope that those who have joined us tonight will also join us again next Wednesday, same time, same day on Wednesday. Again, on behalf of the Section 15 Education Committee, we would like to thank you for Bedros, Dr. Valentina, and also Dr. T.C. for moderating the session. And we hope to hear again from you maybe in the future if time permits. Okay. Thank you very much, Dr. Bedros and Dr. Valentina. Thank you to Amelia, my committee, Datin, and Dr. Shakawan. Okay, thank you very much, and see you again sometime in the future. Thank you.
Thank you, Professor Mohammed Ibrahim. I would like to join to Professor Puha and all of you to wish a happy birthday to our dear friend, dear colleague, Professor Hao Kim Chuan, with the best of health and happiness in his life, because he is a very dedicated, very good professional that I have big respect. Happy birthday and all the best wishes.
All right, thank you. Again, we convey the message to him. I see that he's not with us this evening. Maybe he's having a birthday party with his family tonight. All right. Okay. All right. Once again, thank you. And see you.
Okay, thank you, everyone. Thank you for joining. Everybody keep well, and hope to see you next week. Goodbye.
Bye-bye.
Thank you.
Bye-bye. Thank you again.